Amelia, a 21-year-old patient who, on the occasion of a forthcoming prolonged stay in Ireland as an Erasmus student, after consulting the internet, requests at the health centre to be vaccinated against tuberculosis. When she consulted the Preventive Medicine Service, they replied that this is not required to travel to Ireland. But it is also reported that you can buy the vaccine in a pharmacy. The family insists on her request, and the doctor agrees as long as it is the patient who provides the vaccine. The family meets a local pharmacist who provides it. On the day of the consultation, the doctor arranges with one of the nurses to administer the vaccine. The nurse the doctor is asking for is out of work that week and is being replaced by another nurse who is on her first contract and only has 2 days of experience at the centre and the practices that she did during her studies. The nurse draws the liquid from the vial, dilutes it and administers the vaccine. The patient goes to her house grateful for the care received. The nurse records the vaccination in the electronic medical record. Hours after leaving the health centre, Amelia complains of severe pain where the vaccine was administered. They decide to go to the health centre. The doctor has finished her shift, and the nurse who administered the vaccine also ended her shift. Amelia has an abscess. The doctor who attends the emergency prescribes a painkiller and tells her to observe if she evolves. The normal thing is for the pain to dissipate. The symptoms do not diminish, but increase. Dizziness and vomiting, fever and a feeling of discomfort, so they go back to the health centre the next day. The doctor who treated Amelia asked the nurse if she noticed anything abnormal when administering the BCG vaccine. The nurse confirms that she administered the vaccine intramuscularly and that she made sure to use the entire vial from the container that the patient had given her and left it noted in the patient's medical record. Amelia will require immediate surgery and chemoprophylaxis treatment for 6 months. She is not going to be able to go on Erasmus like she wanted.